Every single woman will go through the transition of perimenopause to menopause to menopause, and each phase prepares you for the next phase. However, perimenopause can be quite horrible and has its own set of issues compared to menopause and postmenopause, which, by the way, I always say menopause is one day because it's 365 days since your last period. So if you go to a menopause specialist and you go and you tell them your symptoms, let's say your symptoms coincide with late perimenopause, and you are having heart palpitations, widespread joint pain, hot flashes, night sweats, you're miserable, you're depressed, you feel like a blue cloud is following you, yet you still bleed. So what do? Like ignore that person who is having perimenopause symptoms of estrogen deficiency? Because yes, they are having ovarian insufficiency, but yet they have just enough, like the little engine that could, to give you some period, but you're suffering. So a menopause specialist is somebody who is trained and has education and has tested. So the North American Menopause Society has a test that you can take to say, hey, I am up to date on education and research, and I belong to the Menopause Society, and I'm reading the latest research and journal articles, so I am not stuck in research from 20 years ago. So I'm giving my patient the most up-to-date care. When I read a comment like this, I'm sure their doctor has their beliefs, but this doctor probably needs either A, mental flexibility, B, to check themselves because they probably haven't read an article anytime soon, and C, should probably see A and B. I am a physical therapist. I don't prescribe hormones. No, I listen to women talk every day. I listen to women cry. And the moment I get the signal in my ADHD brain to say, ooh, my patient sounds like perimenopause, I'm going to ship them back to their doctor. And then I will say to my patient, I want you to say all the things you just said to me. Write it down on your phone. Get your phone out. Get your notes app out, because you're not going to remember because you got brain fog. And then you get all like flabbergasted and the visit goes real quick and you're not going to remember, but not today. You're going to write this down. Better yet, write it in your notes app. Then go write it in your My Chart, because your My Chart is part of your medical record. And so anywho, go write your symptoms down, because based on your subjective reports, what you say, menopause doctors will treat you with hormone replacement therapy based on what you say. So what you say matters. And I promise the specialists in menopause are not saying you need to wait till the cessation of your period and you are postmenopausal. So I'm so sorry. I don't mean to be rude to your doctor, but I have pretty much got sick of women suffering. And so just like anything in life, you can have one opinion, then you get a second opinion, then you get a third opinion if you need to be, because there aren't enough menopause specialists. So if there isn't somebody near you that can give you the HRT you need and you're suffering, we have telehealth. Thank you, COVID, for normalizing telehealth, and Alloy and MIDI Health. You can get your HRT. You don't need to suffer. Nope, you sure as fuck don't, because that's bullshit.